Coming up next on Headline Humboldt, the Eureka City Council this week voted to put the Housing for All and Downtown Revitalization Initiative in front of voters in November, even as several council members expressed serious concern about its impact on the city's plans to provide more affordable housing. Also, Lea Nagy and Jacob Rosen from NAMI Humboldt in the city of Eureka describe how new legislative changes to state mental health laws will help make it easier for family members to put their loved ones in treatment, and how this change doesn't necessarily mean people's rights will be put at risk. Coming up now on Headline Humboldt. From the top of Humboldt Hill, this is Headline Humboldt. I'm James Falk. Thanks for joining us. In reporting and in life, we all maneuver through the world acting as if all the issues we face sit alone in our collective imaginations, independently complex and each do its own unique considerations and solutions. While that's true for the most part, reality is actually a lot more complicated. On tonight's show, we sit down with Lea Nagy and Jacob Rosen. Lea's from the Humboldt County chapter of the National Alliance for the Mentally Ill, and Rosen is with the city of Eureka, to discuss recent reforms to state mental health law that will make it easier for families to get their loved ones help. One of the many difficulties facing both mentally ill patients and their family members is the propensity of patients to deny they need help or to refuse help more broadly for a whole slew of reasons. The new rules will enable families, through a judge, to put their loved ones in treatment involuntarily, a move that Nagy and many others say will help save lives. I have experience in this regard as the son of a diagnosed and at times violent paranoid schizophrenic. At times, Dad realized he needed help. Those realizations would often result in a tearful breakdown and a promise to work hard at getting better. And he did work hard. But Dad's disease was subtle and insidious. Before long, its influence would unsettle Dad's determination and convince him that such help would strip him of the very aspects of his personality that he'd come to value, over and over and over again. This is just one of the myriad challenges facing family members of the mentally ill. Yet one of the reasons these changes have gained so much momentum is homelessness. California, like some other states, has become increasingly besieged by an exploding number of homeless people, many of whom suffer from mental illness, mental health challenges, and here's where our mental health and other story of the night, affordable housing, managed to come together. While treatment and family advocacy are of course absolutely vital in helping folks overcome problems surrounding mental health, a comprehensive approach requires that there be affordable homes available for those folks if and when they get the treatment they need. Both issues are vital. To deal with either one without deep consideration of the other, as well as related issues, would undoubtedly in the end, leave both problems unresolved. Synthesizing our approaches to these and other problems are the only means to a real solution for both helping and housing the mentally ill. Like a lot of things today, we all get so distracted by overly simplistic explanations and social media quips when the true answers lie in considering all such issues as part of a global approach to lifting up those in need and demonstrating a kind of radical empathy. But first, the news. This week, the Eureka City Council voted unanimously to put the Housing for All initiative on the November ballot. Several council members at the same time expressed extreme reservations about how the proposed initiative could hinder the city's work to make more affordable homes available. It seeks to stop the continued conversion of Old Town parking lots to affordable housing developments, as is already underway for 2 existing lots downtown. The initiative also seeks to turn the former Jacobs Junior High School campus into an affordable housing project, despite the fact that the California Highway Patrol is already in the process of trying to acquire that property for its headquarters. The changes proposed by the initiative could put the city out of compliance with its affordable housing goals and could also jeopardize millions of dollars in already allocated grant money. The Housing for All and Downtown Vitality Initiative will be put to voters at the next municipal election, which is scheduled for November 5th, 2024. Mike Munson, one of the sponsors of the initiative, said the issue is about protecting Old Town businesses from an even worse parking situation.
As a co-sponsor of the Eureka Housing for All and Downtown Vitality ballot initiative, I request the City Council vote tonight to adopt the initiative and save the city the expense of placing it on the ballot. We've collected over 2,000 signatures in favor of this initiative from all precincts in less than 30 days. These signatures, along with the result of a third-party survey conducted earlier this year, where a majority of the voters opposed the city's proposal to replace the 9 parking lots with housing, clearly demonstrate the voters are not supporting the current downtown housing plan. Downtown business owners have been attending public and city council meetings for many years to express our concerns about removing the parking spaces that are vital to our businesses. For example, City Council meeting in July 7th, 2020, approving the release of the parking lots at Sunny and Myrtle, 8th and G, 6th and M for development. Several people stood before this body to explain how losing these lots would severely damage their businesses. Several of you said you understood these challenges and seemed sympathetic, but you voted it through anyway, and I've not seen any real alternative solutions. Mayor Burgell, in the Lost Coast Outpost article on February 10th, 2022, regarding the City Council approval of the Earth Center, you were quoted as saying, "I worked in Old Town for 15 years now, and it was hard to find a parking place. And so I hear what business owners are saying, and I want to project. I want this project, so I want it to be able to mitigate these issues together and move on so we can have a win-win situation." You said you were all in on this project with that caveat. You've continued to ignore the requests to work on a better plan, and so you've left us with no choice but to let the voters of Eureka decide this. We support housing downtown, but not to the detriment of the businesses. They're the lifeblood of our downtown economy. If you want to attract visitors, shoppers, diners, or residents to downtown, you need these businesses. We're the ones that are bringing the people downtown and paying the taxes. There's reasons why we have residential districts, and there's reasons why we have commercial districts. To expect everyone to rely on public or active transit is pretty far-fetched. The same survey found that 87% of the people who travel downtown drive there. And just at the last City Council meeting, each of you participating in the week without driving noted how difficult it was not to drive. And that was before you admittedly rearranged your schedule to do all the things that you needed to do to drive before or after the challenge. How can you expect anyone to drive and not find adequate parking? I urge you to either adopt the initiative directly and place it on the March 5th, 2024 ballot for the statewide general election ballot. Thank you.
Several members of the City Council, meanwhile, supported sending the initiative to voters while also calling for an effort to ensure voters know what's at stake.
I just wanted to say that I really wish this ordinance did what it says it wants to do and made housing more accessible in the city of Eureka. I wish that was true. If we could just vote to make housing appear on the Jacobs campus as the representative of the Second Ward, I would really like that, but that is simply not an option no matter what this ordinance says. So I'm grateful for the chance for the citizens of Eureka to read this and to read the analysis of it and to hear some reports about the real impacts of it and how this will actually hit the ground, what it will do, what it won't do, what it can and what it can't do. And this time between now and when it gets to the vote is a chance for the public to become informed and to be able to make an informed decision.
You know, we're going to move forward with taking it to the voters rather than pass it tonight. Could really create some serious problems for the city, including obstructing zoning code, compromising our standing with state law, and cost citizens and taxpayers a great deal of money, as well as potentially lose access to significant grant funding that we're looking at for the city of Eureka. And so, I definitely support continued education and access to public process around this issue so that we can really ensure that people have a deep understanding of what they're voting on and the consequences for themselves as well as citizens, throughout the city, as well as citizens of the future who, according to surveys, many citizens are having great difficulty accessing affordable housing and are spending well over 30% of their income on housing, which doesn't allow people to save money to develop sustainable futures for their families. And so that's really, why I'm supporting affordable housing in the city of Eureka, and definitely would prefer to, or am advocating to go for option number B, or letter B, submitting the ordinance without alteration.
So we're joined now by Lea Nagy from NAMI Humboldt, which is the National Alliance of the Mentally Ill, for the Mentally Ill, in the Humboldt County chapter. And Jacob Rosen, you're the Chief Clinician with the City of Eureka. So thank you guys for joining us. This issue surrounding mental health and a broader perspective, homelessness, and all of those issues are extraordinarily complicated, and it's hard for people to get a real grasp on what the facts are, both on the ground with developments like this and then the long history leading up to the situation that we're currently in. So I thank you guys for joining us and for taking the time to help us try and navigate through these intricacies. Lea, can you give us a little bit of a sense of what NAMI Humboldt is and what it does in Humboldt County? And then you mentioned there's a couple things that you wanted to announce.
Yeah, sure. Thanks, James. First of all, I really appreciate you doing a program like this. we can talk about mental illness and mental health services and other things that sometimes aren't discussed. So I'm currently president of NAMI Humboldt. NAMI Humboldt's a grassroots organization started in the 50s by two moms that had a couple of girls with schizophrenia. It is now an organization here in Humboldt that supports our families. I do support groups every week, 2 in Eureka, 1 in Redway. We do a family-to-family class that's 8 weeks long that's currently being taught, that's free. And we also have a multicultural symposium on November 4th at the Warfinger Building. You can register 9:30 or you can register online. And it's going to be a panel of people with lived experience and also professionals. And we'll talk about multicultural issues relating to mental illness and mental health. Yeah. And it's totally free. Lunch is provided. Anyone can also email me at leanagy@yahoo.com. That's LEANAGY @yahoo.com, and I can give them any further information about stuff. Okay. So yeah, it's NAMI Humboldt is an advocacy group. It also offers support, and we're just really glad that you wanted to have NAMI Humboldt on the program.
Well, I appreciate that, and I thank you guys you guys do invaluable work, and I appreciate you for being so willing to come in.
Thank you.
Jacob, you're a fount of information on mental health issues. We had a conversation just now that floored me in terms of the intricacies of the different laws and the bureaucracies that are involved and its impact on people's lives. Can you talk a little bit about what you do for the City of Eureka and the CARE program and that sort of thing, if that's relevant?
Yeah. So prior to coming to the city, I worked for the county behavioral health system in Semper Virens in the crisis stabilization unit and the mobile response team for about 6 years. I came to the city in August of 2022. To help start their crisis team. And so we're developing CARE, which is Crisis Alternative Response of Eureka. Mm-hmm. Our goal is to provide both co-response and eventually alternative response to mental health crises and substance use related crises within the city of Eureka. So we collaborate very closely with Eureka Police Department and their community safety engagement team. Yeah. My kind of primary counterpart is Commander LaFrance within the department, and we're really working together to kind of build this department out so that we can provide better crisis services in the city. Yeah. And super appreciate the opportunity to come on and kind of talk about some of the changes that are coming, because there are a lot. We had a lot this year, we have a lot coming next year, and it's super important to try and get that information out.
That's LaFrance I've had him on the show before, and they've done vital work in terms of trying to, intercede when things are complicated by either mental health issues or drug addiction issues. And obviously, I'm
absolutely
prone to follow the drug addiction stuff, but the mental health stuff is probably even more important. Can you talk a little bit about what the percentages are of how often is that an issue in police interactions where mental health or addiction play a role in the shenanigans, I guess?
So I don't have a lot of the other data that we keep, but I know currently we're seeing probably about 130 mental health related calls coming into 911 dispatch with EPD per month. And so, our team is just me and 2 case managers currently, although we were just awarded a grant that was $625,000 from the CARE Star Foundation to be able to then expand our team. So that'll hopefully double our team size over the next 3 years to be able to help and accommodate that. But the calls are frequent, and it's a lot. And it can be anything from someone who's a concerned citizen who sees someone who's disorganized and maybe they're talking to themselves or responding to internal stimuli. It could also be that someone is becoming aggressive, and that's causing some sort of threat. And so the calls can be very dynamic, requiring sometimes law enforcement to maintain safety, also sometimes a mental health presence. Our hope is to be able to continue to insert that mental health presence so that we can kind of help broaden our capacity to better, provide a better service for those calls.
Yeah. Thank you for that. Lea, so we talked last week, I had you on the show to respond to an initial report of the signing of the laws. It seems like Governor Newsom has been making a real effort to see some reform on what have been historically sort of laggard rules in terms of handling this issue. But can you give us a brief summary of what you think these new rules are going to do for folks in terms of both families and patients?
Okay, James. Well, first of all, this is just a drop in the bucket. This is just a good start. Thank God we're starting to talk about changing laws that are historically, 50, 60 years old. So the new gravely disabled law, it will be expanded so that if someone, so in the past, if you had your loved one and you were providing them with food, shelter, and clothing, you were told, make them homeless, don't give them food, don't support them, and then they'll fall into the gutter and homelessness and maybe get the help they need. And most of us love these kids. We believe that mental illness is a chemical, biological brain disorder. And if your child has cancer, you're not told to abandon them. So this new law will enable families to help their loved one. But then if the loved one, in the case of one of my sons, is kind of manic and walking in the street and doing unsafe things, if the personal safety is in jeopardy, a family can still help your loved one access services to be placed on a 5150 and to get some mental health treatment. It's not like families can now just put people into treatment.
Yeah.
The 5150 laws, the 5250 laws, they're still in place. And it's a very complicated, as Jacob and I were talking to you earlier, on the whole procedure. It's not an easy thing to do.
It's reviewed multiple times by multiple officials, all of whom are trying to do the most appropriate thing for the patient.
For the person.
Yeah.
And just a really quick, wonderful story about my son who was just recently involuntary treated. And I asked him, what do you think about involuntary treatment? He says, well, at first, it's kind of interesting. I would go into sempervirens angry and stressed and upset and, psychotic, and I would leave with peace and recovery, and he now is on a wonderful medication, and he's just doing amazing. So in the beginning, it's hard for families, and I think it's hard for the person with the mental health challenges. Sure. None of us want to be involuntarily taken away our rights, et cetera. But we do involuntary treatment. We do it in the jails. 356,000 people are in jail.
A lot of times the alternative is do something like this, or they end up in prison, and we're spending more money doing something that's destructive for everybody rather than trying to get someone the actual help that they need.
Right. It's not helping a person to be in a jail cell. It's more therapeutic to be in a mental health hospital. But
absolutely.
Anyway, thanks for asking me that question. That's one of my passions, as you can tell.
Yeah. Well, Jacob, we were talking earlier about this issue, like you mentioned, and it's interesting that the language of the original law, which dictated how people had to be put into treatment or what people could do to get this kind of involuntary thing started. And just because of the way that the original law was worded, that made it so that families were told sometimes not to care for their family members, because by doing so you would disqualify them for the diagnosis necessary to get them treatment, right?
Right. And so I think it's important to cover kind of the criteria for the 5150, right? And so the 5150, as it is right now, before this law takes effect, is danger to self, a danger to others, or gravely disabled.
The person has to be that in order to be.
They have to be that in order to be detained. And so danger to self is an imminent threat to oneself due to a psychiatric illness. Danger to others is the same thing, but for others, right? An imminent threat to other people due to a psychiatric condition. So that's not someone is, robbing a bank or, trying to break into a store, right? It has to be related to a psychiatric condition. And then gravely disabled, which was due to a psychiatric condition, the person cannot access food, shelter, or clothing. And those three things are incredibly important, right? I mean, if someone can't access those, that's devastating for them. The issue that it created was under the way the criteria read in the law is if you had a family member who was providing that food, shelter, and clothing, it often made it so that it was difficult to detain that individual, even if the family is wanting that, even if it seems very obvious if this person didn't have family supports, they would very much be put on a hold. It was very difficult to bring them in for treatment and really kind of help get them, start the process of getting them better, which can sometimes take weeks. And so what we saw is a lot of people kind of having their treatment delayed and a lot more trauma happening to the family and to that individual because things had to get much, much worse. Or some of the worst conversations that I've had to have with families is talking.
The impact on the workers has got to be bad too, because you're telling people, well, step away from your loved one so that the process can take place. But they're like, what do you mean step away? This person's at risk and they're in danger.
It's an awful conversation to have. I mean, to have to talk to a mother to say, hey, I need you to kick your son out of the house and not provide him food or clothing anymore. is awful. I mean, it's not something that we in the healthcare field should be having to have that conversation, right? And so the beauty of this change is it adds personal safety or neglecting critical medical care. And so the personal safety piece is the larger one that kind of comes up more often, right? And so even if family is providing for someone's food, shelter, and clothing, if that individual can't provide for their personal safety now, it opens that extra criteria of under gravely disabled to be able to help get them in for involuntary treatment. Which really then, again, can help families, can help that individual, and we can start the treatment process sooner, which is super, super important.
Yeah. Now, one of the things that we talked about last week, Lea, was the fact that what's really pivotal with this is whether there's going to be money. Is the state going to put its money where its mouth is in terms of mental health treatment? There's a bond initiative, I guess, coming up in March, and even more changes coming up in November, it sounds like, that may do some work in trying to get this funded. Can you talk a little bit about what you understand about those proposals?
I know that Governor Newsom wants to put on the ballot, some funding for 10,000 more psychiatric beds, which, as we know, we don't have enough beds. There's a workforce development part, which again, our county and all over the nation is short on mental health care workers and
psychiatric nurses, and
professionals,
psychiatrists, and
things like that. And so those things are going to be really important. Jacob has a little bit more probably to add to that. But I think we're just starting to look, people complain about homeless. In fact, one of my best friends said to me, well, they just want to be homeless. And it's like, the topic of, I don't want to change the topic, but the whole thing about anosognosia is now we have brain research. We've been doing brain research. We realize that serious mental illness causes issue with insight. So if you touch a hot stove, it's hot, you're not going to go back and touch it again. But with mental illness, it takes away the insight. Oh, if I go off meds, I'm going to be, mentally ill. There's a book called I'm Not Sick, I Don't Need Help. And you can't blame them. They don't feel they need the help. But we, as family members and community members, watch them deteriorate, watch them maybe run through the neighborhood naked, maybe destroy parts of their body. I mean, it can be so dangerous to others, dangerous to self, because they just don't know that they need the help. And that's where the involuntary treatment help comes in. And boy, once, I don't know, in the case of my family, my kids, my grandkids, once they're on the medication, we get our loved one back the way, the way they are sane and not psychotic and not.
And the value of that for both that person and the family members, it's immeasurable, right?
And the community.
Yeah,
and the community. Absolutely. It's a win-win for everybody.
Yeah. Jacob, do you have anything to add on the funding front?
James, that piece is so important. The symptom, it is a symptom, right? I mean, this isn't just that people with mental health issues don't look into it. Anosognosia is a symptom that comes with serious mental health.
So that's the inability to do consequences
it's the symptomatic lack of insight or loss of insight, I should say, right? Because usually, as we kind of go through the day, we have the ability to introspect. We have the ability to look back if we say something. Right? Exactly.
Don't we all?
If we say something wrong in a meeting, or oops, that didn't sound great, and we can then kind of come back and repair that. Individuals with severe mental health issues like schizophrenia, like bipolar disorder, like schizoaffective disorder, they lose that ability to introspect and really kind of recognize that they're sick. And so, and it kind of makes sense in a way, right? I mean, if you look at other disorders, you have a respiratory illness, your lungs lose that capacity. Well, our brain does that introspection, and so when we have a brain disorder, our brain loses that capacity. And so it makes sense from a medical perspective. I think the difficult component is that it makes treatment really difficult, right? If someone is having trouble breathing, there's a lot of instinct that kicks in to say, hey, we need to resolve this. When someone loses the ability to have that instinct and that introspection, it makes it so that they don't necessarily recognize they need treatment. And so, that's where these changes in the law really come into play, is being able to help those folks sooner. Because the faster we can get them treatment, what we find is the better their overall trajectory of health is. with the brain, we know that there's kind of a priming effect. And the more someone is in a psychotic state or in a manic state, the more the brain becomes primed to be in that state. Absolutely. And so what we find is, someone who maybe the first time they're sick, they start at the top level of stairs, they kind of come down 3 stairs, and then when they get better, they go back up 3 stairs. Yeah. After many, many, many episodes and delayed treatment and prolonged states of psychosis or mania, they may only come back up 2 stairs, or maybe they go down 3 and then they come back up 1. Yeah. And then when that continues to happen, what we see is an overall kind of decrease in functioning to where it becomes more difficult for professionals to help them recover, but also their overall level of functioning, even once they have recovered, is very well diminished, which is an awful situation for them, but also then that becomes a real burden for the system, because then we have to be able to provide housing, we have to be able to provide services for that person who now has decreased functioning because we as a system took too long to get them the care that they needed.
Yeah. Yep. These problems are so vast and the numbers are so high. It's a daunting problem to consider from a distance or even up close, of course. What aren't we addressing with these changes, and what are the things out there, the great white whale of what's the mental health system that needs to get fixed that we haven't even begun to address yet? We have about a minute and a half left.
Oh my gosh. Well,
Quick.
that question is huge. I just think we need to address a community that gets more involved in caring for our most vulnerable person. And like I said before, you measure a society by how they treat their most vulnerable person, and those are our homeless and our loved ones with mental illness. I mean, it's just, everyone has a part, whether you get a sandwich for somebody on the corner or you vote for more services, everyone in our community has a part to make things better. And it's just little steps at a time, over time. And I believe, we always say at the end of our NAMI meetings, we will never give up hope. Yeah. And we just keep fighting for a better future and a better society. Yeah. Jacob?
I would agree with all of that, and I would add, I think the bills that are being signed, we're seeing them progressively take steps in that direction, right? The beginning of 2023, we revamped some of the 5150 criteria to make sure that it's more patients' rights informed, so that folks don't just kind of languish in the ER without having their situation reviewed by a hearing officer. Care Court is coming down the pipeline, has to be implemented by some counties, I think, just in the next couple months.
Yeah, which is going to be a separate place legally for folks who have these issues to get dealt with in a way that's more appropriate to their situation.
Absolutely. That'll be more involuntary treatment in outpatient as opposed to having to have someone go inpatient, which is less restrictive. Absolutely. So that's kind of that middle ground. Yeah. And with these changes with reforming the MHSA funding and
Mental Health Services Act, just so people at home, which we passed in 2004, I think.
Yep.
Right. Yep. And so that's a tax on folks making over $1 million a year that then goes into kind of a lump sum and then gets dispersed out to the counties for lots of mental health funding, which is really critical. That's being reformed. Adding this funding bill to kind of promote more bed access is super important. And that's just not inpatient beds. That's also crisis residentials. That's also low-income housing, right? They're really kind of broadening that out because we recognize we need things at all levels. Yeah. And then that's also where the treatment comes in. Treatment for the clients, we can get them to that housing, but then we can also build up the workforce. There's a workforce component in that too. Because if we don't have the workforce,
none of this means anything.
Right,
we don't
exactly.
have a way to deploy it.
Yep.
This is only scratching the surface, like you said.
Yeah.
I will have you guys back. I appreciate you coming on the show and helping people understand what these changes mean and why it's so important. So thank you so much.
Thank you.
That's it for this evening. We'll see you guys next week. Stay tuned. Stay informed.